And still in the news, according to statistics, malaria is the second most lethal condition in Africa. Numerous medications, including both conventional medicine and herbal preparations, have been discovered and are being utilized to treat and prevent the malaria parasite. But many of these medications have been proven to be ineffective against the parasites that cause malaria. Overdosing and the usage of illegal medications have exacerbated the issue of malaria parasite resistance. However, according to the 2021 Nigeria Malaria Indicator Survey report, the country's malaria prevalence dropped from 23% in 2018 to 20% in 2021. According to the NMIS data, malaria prevalence is highest in the Northwest, where it is 51.6%, and among children aged 48 to 59 months. Our correspondent Adewale Murumoke has more on this report.
Malaria is a life-threatening disease caused by parasite transmitted to humans through the bites of infected female mosquitoes. Parasites from Plasmodium genus, especially Plasmodium falciparum, the most dangerous species, caused severe illness in humans. Malaria transmission is most intense during rainy season when mosquitoes populations thrive. The seasonality contributes to a higher incidence and prevalence of malaria, leading to increased morbidity and mortality rates, particularly in tropical and subtropical regions.
Malaria is a tropical disease caused by a group of Plasmodium parasites, which are transmitted by mosquito. When they bite human beings, they deposit the parasites in the red blood cells of the patient.
Malaria is a multisystemic protozoa disease that is very common in the tropics here in Africa. It occurs more commonly here and is caused by a species of Plasmodium, which is a protozoa, 4 different species of Plasmodium, and is transmitted mainly by the female Anopheles mosquito.
The most effective ways to prevent malaria is by using bed nets treated with insecticides. Sleeping under bed nets prevents mosquitoes bites during night, which is when Anopheles mosquitoes responsible for transmitting malaria are most active. Applying insect repellent containing DEET on exposed skin can serve as an additional layer of protection against mosquito bites. It is essential to follow the instruction on the repellents for its effective use.
People can use nets in their bedrooms. They can use repellents or insecticides to kill the vector, that is the carrier, which is mosquitoes. They can use nets in their windows. And more importantly, cleanliness. They can prevent garbage collections from their different homes.
Surroundings by clearing the bushes, clearing stagnant waters, and even while at that, they also need to make use of mosquito-treated nets, make use of insecticides, and give themselves malaria prophylaxis for those traveling from non-endemic areas.
Malaria can be prevented through we could clear the bushes around, we could make use of mosquito-treated nets, we could make use of insecticide, and also we could actually use prophylaxis. That is for those that are traveling from non-endemic areas to endemic areas, commonly in tropical countries, e.g. Nigeria.
There are about 4 to 5 groups of individuals that are more predisposed to having malaria. Children under 5 years old, non-immune pregnant women, immune-compromised patients like patients with HIV, and people traveling from non-endemic area to endemic area. For under 5 children, their parents need to be more interested in putting them inside mosquito-treated nets.
Children, if they are not properly cared for, they tend to be prone to malaria infections. Mothers usually during pregnancy are supposed to take some anti-malaria treatments.
For under 5 children, their parents need to be more interested in putting them under mosquito-treated nets, clearing the surroundings.
Children under the age of 5, pregnant women, or those traveling from non-endemic areas to endemic areas, they could also use the use of they could use or sleep under mosquito-treated nets.
To eliminate malaria, it requires the concerted effort of individuals, communities, and governments. Malaria is a preventable and treatable disease that can be eliminated. We can all play a significant role in achieving this by adopting and implementing malaria prevention measures, supporting community-driven initiatives, and demanding that our government take actions to end the scourge of malaria. Together, we can make malaria history. Adewale Moromoke, reporting for KAFTAN TV News.